External auditory canal. The external auditory canal anatomy, does it bother in your endoscopic ear surgery? Professor Sundarakishan?
Not necessarily, because that is one of the main advantages of endoscopy. Because of the panoramic view given by the endoscope, you can see beyond the canal. Sometimes the canal has to be there. If you use a microscope, you have to why it means that the canal has to be.
Exactly.
You can bypass it and you have good view of the planning.
Exactly. So external auditory canal, when it is narrow, or if there is any hump, anterior hump, or if the anterior tympanic sulcus is too anteriorly placed, these are the indications where endoscope helps. And when you are not able to put a grommet, just because only half of the tympanic brain is seen with the microscope, and you are not able to put the grommet. So in such situations, endoscope plays a very important role. So for Badimon, do you have any additions?
If you want to confine yourself to the transcanal surgery, definitely endoscope is a much better tool than the microscope.
Okay.
So definitely we can have a panoramic view on that. And you have a choice of endoscopes with diameters.
Yeah, that will come next. So now since Bharadimon was talking about the endoscope, what would be the preferred endoscope that you would do for a ear surgery, just for the beginners? Will you use the 4 mm nasal endoscope, or will you use the 3 mm auto endoscope? Which would you prefer, and what are the highlights, what are the disadvantages of them?
I always do use a nasal endoscope more than.
Okay. Do you use a wide angle, sir?
Wide angle. So
Okay.
the advantages are you use better inside. Not only that, with the maneuvering of instruments, when you're using a shorter endoscope, it's the hindrance. But here you have a new range capacity there, and you can manipulate the instrument better.
Yeah, Anthony.
The auto endoscope is 3 mm actually. So the quality of the picture, illumination, and the output will be not as good as that of the 0-degree endoscope. But generally the people who have started doing, or they are skeptical about endoscopic ear surgery, thinks that smaller than endoscope you get in more space. It's not like that. The endoscope and the your instrument will not be at the same plane. The endoscope will be little outside, and all you got to do is just bypass that, and you can do the surgery.
So,
Also, you have the focus of the endoscope. So you can hold the endoscope very further away. So the instrument can be manipulated.
exactly.
So recently I attended a Society of Endoscopic Otologists conference where they promote 3 mm endoscopes.
Okay.
3 mm diameter endoscopes and 10 centimeter length endoscopes. Wherever now what we are using is a 4 mm
Yeah, but generally when you use a 4 mm, you have a better clarity of the picture rather than 3 mm. And since the clarity is better, the camera also shows the picture better.
Definitely 4 mm is a much
Better
picture is very much
good. So, what would be your preference? Whether it is this is something called a Scone's criteria, which is further classified into 0, 1, 2, 3. Sorry, 2A, 2B, and class 3. One is when you are using only endoscope. So, sorry, microscope. So these are the people are, you say that you have done a class 0 tymparoplasty according to Cohen's criteria, and class 3 is entirely endoscope only. So microscope is not used. So this is a general criteria as to what is the use of the endoscope. And I would like to know the panel's viewpoint regarding any middle ear surgery, whether you will do class 3 or class 0 or class 2A, 2B.
Always class 3.
No, not for this discussion. You can put in your, because it is the juniors who are going to ask.
Very rarely we have to use.
Okay. So previous talker also was saying that mastectomy is no longer necessary. So you don't have to think about doing going into the mastectomy when you're using an endoscope, because it's no longer going to help. With or without mastectomy, it's not going to.
Glucosal type, but for cholesterol,
Cholesterol, of course, we are going to do.
disease extends deep into the tip of the mastoid. Very rarely you will have to use microscopes to open.
Okay.
On the contrary, when some of my younger colleagues, when they do surgery with the microscope and find it difficult, we take endoscope. It's not the other way around. It's only always middle ear, always endoscope.
Okay, but watching because I am from Madras Medical College, I don't know about the other medical colleges. Here, most of the assistants are even the chiefs. They have both endoscope and microscope. Initially, for the middle ear, they use the endoscope. Once they are fairly clear, they want to do a mastoidectomy, they go to the microscope. Or sometimes they will be fully class 3.
So literature is in favor of endoscopy.
Yes, that I will tell you later on. So these are the advantages of endoscope, where with a microscope you have a pure perpendicular view, whereas with endoscope you can look into the corner. So this is one of the biggest advantages of endoscope. But there are other people who say that the depth of vision is better with microscope. Like you keep on changing the depth of the. Suppose you have put in made a hole in the sleepy soot plate, and you can see even the fluid there with just adjusting. Whereas that it's a bit difficult with endoscope because that has not come. But of late, Stryker has brought in a high zoom for this one also. So even that is being addressed. So any problem will have a solution. Anything you wanted to say, sir?
You were saying you can't see the fluid very
No. The depth of the vision.
Yeah.
So depth is whatever you see, that's what you see. And with the camera, we'll have to adjust the focus. Now, when it will show you the picture, whatever is seen. Whereas with microscope, we can adjust.
Yeah, that's what for the beginners I would like to tell. If you use the microscope, you got stereoscopic vision. So you can depth assessment is good. But with endoscope, you can compensate that by palpating the adjacent tissue. Like near the foot plate, you can palpate and get that stereoscopic feel. So it is definitely endoscope can compensate.
Actually, to see the depth, what we do is, when you have a binocular vision, you feel that your perception of depth is better. But with an endoscope, you move the endoscope in and out. When you move the endoscope in and out, you can see the depth, you can see what is the various structures.
So exactly, that is what Dr. Anthony is trying to say. So what you find here is